mallet finger or mallet fracture. I will show you one example. I am Dr. Jee-Hyung Kim. 60-year-old male patient who was injured 20 days ago. He was worried because 20 days have passed already. There is a gap and there may be something blocking the bone union. This is immediate post-op X-ray. Please refer to other video to how to operate. This video answers the question about rehabilitation and post-operative management. You can see that it was well reduced. This is the second day after surgery. It is well maintained. 14 days after surgery, you can see that the bone fragments have moved slightly. Okay, compared to this, slightly moved. I thought there was no problem with stability, so I decided to keep it. This is a 7-week X-ray. Compared to the second week, you can see the one KR moved slightly in the direction of the red arrow. The joint is not violated, so there is nothing harmful. So the lesson can be learned from this that it would be better to avoid inserting cable too much. 2 weeks after surgery, the first active and passive joint exercise begin. In addition to injury joint, check out joint carefully. Okay.
가만히 있으면 관절이 굳기 때문에 지금 2주 만에 움직임 연습하는 거예요. 움직임 연습 제가 하겠습니다. 본인 아실 필요 없어요. 아프세요? 됐습니다. 연습해 주시고 일주일에 한 번씩 만나겠습니다. 받겠습니다.
When you first move, he may have pain, so move very gently. Then gradually move it over. 8 weeks after surgery.
자, 시험은 거꾸로 뒤집어 가지고 동그랗게 발사하게 합니다. 시험 체크. 자, 더
10 weeks
어둡게.
after surgery, check in operating room for removal. When you place your hand on the radiating part of the C-arm, you can see the finger with the largest zoom. As short as possible to minimize the radiation exposure. Local anesthesia is performed just on the back of his finger.
아프세요?
Untie the hook and remove the thick K-wire in the longitudinal direction.
슬로로.
And let's check if the fixation is maintained with one thin K-wire.
이렇게 됐어요.
Slide push the thin K-wire back to see where it protruded from the back of the finger. Okay, can you see? And you can touch it. Put a small incision in that place. And push the K-wire, thin K-wire slightly. Okay, you can see. And cut out the part of the thin K-wire that came out of the skin. And pull again to remove. And cut. And remove. Easy, very easy. And then watch for the active joint movement and fixation.
자, 구부리 펴 보세요.
Under C-arm. Okay.
펴고.
He can move his finger actively. Okay. Just one stitch. In some cases, it cannot be stitch. It can be omitted. Later, the wound is barely visible to the naked eye.
자, 구글
10 weeks
보세요.
after the first
아니,
surgery,
중국 적었어요.
2
지금
weeks
전체를 다
after
지금 적었어요.
removing the K-wire, it
치고,
is confirmed that all active and passive
잘
joint
구멍
exercise
치워주고, 펴보세요.
movement are normal,
잘 펴주고, 주먹 접으세요.
and the outpatient
펴주고,
treatment is completed.
쭉 펴보세요. 오케이, 이 정도. 오, 아주 좋았어. 아주 좋았어.
I maintain the fixity for 8 weeks. Some doctors may have a longer length, and they may be slightly different. Usually for fingers fracture, in other area, I remove the metal in almost 3 or 4 weeks because of stiffness, and then start to exercise. Considering that this area, the mallet finger, is fixed for a very long time. So I wonder how much more I can reduce the period. Several doctors may have different opinions. Please leave your comments. And extended block method, many doctors are using, not allow and cannot allow joint movement during the fixation period, maybe 8 weeks or more. Also, 2K wire in extended block method are inserted into a small joint. I think this is better for the joint in many ways. I think my method help patients shorten the rehabilitation period and protect joint in the long run. In addition, it is not expensive. Comments from multiple doctors are welcome, and the patients can leave comments also. I cannot answer every comment every time, but I will try to answer as much as possible. Thank you.